Well, first up on your story, new evidence suggests that France may have had its first cases of coronavirus in December last year. A French hospital which retested its old samples found evidence that a patient admitted in December was infected with COVID-19. This was nearly a month before the French government confirmed its first cases. Now, this means that the virus was circulating in Europe at least a month before the first wave. During the study period, 14 patients out of 58 admitted for influenza-like illness were included in the analysis. A 42-year-old man born in Algeria who lived in France for many years and worked as a fishmonger was admitted to a hospital on 27 December. He was exhibiting symptoms that later came to be known as COVID symptoms, including a dry cough, a fever, and trouble breathing. What is even more shocking is that the man had no recent travel history to China or any other hotspots. His last trip was to Algeria during August 2019. He has since fully recovered. But even with this evidence, it is too early to know whether he was France's patient zero. The hospital has alerted the National Health Agency, urging other virologists to retest swabs for COVID-19. Hospitals had been asked to check the records for patients from early December. Furthermore, since these results change our understanding of the dynamic of the epidemic, the world is possibly predicting the evolution and outcomes of the virus propagation on biased data and would need to be adjusted to the actual profile of the pandemic. The World Health Organization says that it is not surprising that a report of COVID-19 has emerged from December in France and earlier than it was thought to have spread, saying more reports of early cases were possible. The WHO has urged countries to investigate any other early suspicious cases. Europe did not start reporting cases of coronavirus until January. Until now, France's first 3 cases of coronavirus were confirmed on 24 January. This included 2 patients in Paris and another in southwestern city of Bordeaux. 2 of them had travelled to Wuhan, where the outbreak broke out, and the third was a close family member. And Lucy Huff is now joining us live from Brussels for the latest on this. And Lucy, a major revelation that the first COVID-19 case in France could have happened as early as December, debunking those theories of where it came from and how it spread possibly.
Yes, and I think it throws into a new light the initial response of European governments, which was very much about tracking people who'd recently travelled to Wuhan or China and isolating those individuals, hoping that that might stop the virus from entering Europe in earnest. But clearly the virus was here a lot earlier than we thought. If this new case in France is to be trusted, we understand, as you were saying, that this is a 42-year-old man of Algerian descent who was checked into a hospital in Paris with pneumonia-like symptoms. But on re-looking at his case, it's been established that he was testing positive for COVID-19. He was able to check out and is now in good health. But that was a month before the first 2 official cases were reported on January the 24th of 2 individuals who had recently travelled from Wuhan in China. So again, I think we are likely to see this pattern be repeated elsewhere in Europe, with a number of European countries looking back at cases in European hospitals that at the time were recorded as things like pneumonia, but may now be signs that COVID-19 was in Europe much earlier than we initially thought.
Right. And Lucy, also, what's the situation like in the worst affected nations in Europe? Italy and Spain seeing some sort of normalcy return, but it seems to be different when it comes to the UK.
Yes, we've had some appalling figures from the UK today, that with all the UK territories combined, the death toll is now in excess of 32,000, which makes it the worst affected country in Europe, surpassing even that of Italy, whose death toll is just over 29,000. Italy, of course, long the epicentre of the pandemic in Europe, but the Italy's death toll does not include suspected cases. The UK's does, which might distort the figures, and experts are saying that the daily death tolls do need some analysis because of the way that data is collected differently in different countries. But it does add to the criticism, particularly nationally, of the UK government's handling of the crisis, that it failed to put a full lockdown in place until some 2 weeks after the one that was imposed in Italy, again with evidence that perhaps there were cases in European countries much earlier than was initially expected. It is thought that perhaps the UK government's delay in imposing that lockdown may have cost thousands of lives. Italy imposed their lockdown on March the 9th. But this week we are seeing some signs of improvements there, some tentative steps towards normality. On Monday, Italians were able to return to work in many parts of the country. Some 4.4 million people were eased back into the workforce. Face masks were mandatory on public transport, and schools will start to be eased back in, we think, over the coming weeks and months. Again, in Spain, Spaniards in the strictest lockdown in Europe, adults were allowed outside of their homes for the first time in 6 weeks to take some outdoor exercise.
Right, absolutely. Lucy, thanks very much indeed for